Hello everyone, my name is Michelle Putnam and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share weekly updates on COVID-19 and our latest resources and guidance. Today's call will focus on CDC's guidance for preserving resilience and mental health during the holidays. First, we will hear from our COVID-19 response acting chief medical officer who will describe where we are with the response and give us insight into recent scientific findings. Then we will hear from Dr. Kathleen Ethier, the Director for the Division of Adolescent and School Health, who will discuss strategies for coping with mental health during the pandemic. And afterwards, our speakers will answer questions we received over the last week via email. I will note that if you experience technical difficulties or otherwise would like to review today's call, you can find the recording on cdc.gov and YouTube within about 8 to 10 days. All past partner calls can be found there, so please take time to review and share prior recordings. If this is your first webinar with us, welcome. These calls occur every Monday at 3 p.m. Eastern. Please see the link on the slide to subscribe and receive future call invitations. Please note this call is intended for CDC partners involved in the response and is not intended for media. Should media who are listening, though, have questions, we invite you to reach out to media@cdc.gov. Also, we'll have two short polls, one now that some of you all may have taken when you first arrived, and another at the end of the presentations to get feedback about the effectiveness of these calls. So please go ahead and answer the poll if you haven't already, that's up on your screen now, and we'll get started, and then you'll answer another one before we start the Q&A section. These calls are designed to share the latest science, guidance, and resources from CDC's website. There are over 2,000 documents providing information and guidance for individuals, businesses, and the public on cdc.gov. In addition to the resources we'll discuss today, please check out these recent web editions. For the holiday season, CDC has released updated guidance to slow the spread of COVID-19 during small gatherings. Please see the link in the chat. Another resource is the How Right Now initiative, which is an initiative funded by the CDC Foundation with technical support from CDC experts. This initiative exists to address people's feelings of grief, loss, and worry during COVID-19. I'd also like to mention CDC's new adolescent mental health webpage. This page from the Division of School and Adolescent Health shares support for schools, families, and parents in protecting their adolescents' mental health. This is especially pertinent during the holidays, as a CDC behavioral health study recently revealed that more than 1 in 3 high school students had experienced persistent feelings of sadness or hopelessness in 2019. This page also discusses how connectedness, open communication, and a safe and supportive school environment can positively impact an adolescent's mental health. I'm pleased to be joined today by 2 CDC experts on the COVID-19 response. Dr. Cliff McDonald is Acting Chief Medical Officer for the CDC COVID-19 Emergency Response. Dr. Kathleen Ethier is the Director of the Division of Adolescent and School Health. Now let's turn it over to Dr. McDonald for some updates.
Thank you, Michelle, and welcome to everyone joining us today. My name is Dr. Cliff McDonald, and as mentioned, I am the Acting Chief Medical Officer for the response. Today, I'd like to provide a brief update on the response and review some of the latest scientific developments. First, a situational update on cases and deaths. There's increasing and widespread COVID-19 case incidents. Overall, the daily number of new cases and new deaths has been increasing since mid-September and early October. But it's important to note that the weekly average of cases over the last 7 days is 6% lower than the previous week's average. However, given the recent holidays that could potentially impact testing and reporting, as well as all the holiday travel that may increase transmission, we need to remain vigilant to the possibility that this is only a temporary reversal in trends. Well, what does this all mean? Well, when the percentage is decreasing, this tells us that mitigation efforts are working. When case counts increase, this tells us that we, of course, need to step up mitigation efforts to slow the spread of COVID-19. One additional note, 80% of jurisdictions, which include states, territories, and some cities, are in increasing trajectory status for cases. We encourage you to visit CDC's data tracker for the latest stats and COVID View for a weekly summary of key indicators for the pandemic. This week, I want to share some of what we've learned recently from 3 reports, one of which was published in the COVID-19 Science Update, while the other 2 were from the Morbidity Mortality Weekly Reports. In the interest of time, I'll only briefly touch on the high points of these reports, and I encourage you to visit cdc.gov to read the full reports. First, the November 10th Science Update outlines a study evaluating the association between COVID-19 infection, exposure risk, and mental health among a cohort of essential retail workers in the United States. Results from the study show that those workers who can practice social distancing consistently at work had significantly lower risk of anxiety or depression. Another remarkable finding was that workers suffering from depression were more likely to commute by public transportation or share rides with others compared with those who were not suffering from depression. See the link in the box here for more information about this study in that science update. Next, in the November 13th Morbidity Mortality Weekly Report is a report of a study from a wedding reception with 55 persons in rural Maine that led to COVID-19 outbreaks in the local community, as well as at a long-term care facility and a correctional facility in other counties. Overall, 177 COVID-19 cases were linked to the event, including 7 hospitalizations and 7 deaths, 4 in hospitalized persons. To reduce the spread of COVID-19, persons should avoid large gatherings, practice physical distancing, wear masks, stay home when ill, and self-quarantine after exposure to a person with confirmed COVID-19. Check the link in the box to get further details on this MMWR report. Finally, another November 13th study, another MMWR study, describes the rise of mental health emergency department visits among children aged 18 years and younger during the COVID-19 pandemic. For kids and teens, increased stress related to the pandemic can be linked to abrupt disruptions to daily life associated with mitigation efforts, including anxiety about illness, social isolation, and interrupted connectedness to school. With schools being closed, emergency departments have increasingly become the first point of care for children's mental health emergencies. Yet the emergency department's lack of adequate capacity to treat pediatric mental health concerns potentially increases the demand on systems already stressed by the COVID-19 pandemic. The study reveals that there is a continued need to expanding mental health services for children, such as mental health and technology-based solutions, such as mobile mental health applications. There is also a need to continuously improve healthy coping strategies and resiliency among children and families. To read more about these and other reports, please follow the links you've seen in the screen in the chat box. Before we move to today's speakers, I would like to remind everyone that the flu season is here. With rare exceptions, the CDC recommends annual flu vaccination for everyone 6 months of age or older. I encourage everyone on the call to get your flu shot and to support flu vaccination efforts within your organizations. Now is a great time to get the flu vaccine. With that, it is now my pleasure to hand you over to my colleague, Dr. Kathleen Ethier.
Thank you so much, Dr. McDonald. As Dr. McDonald mentioned, my name is Dr. Kathleen Ethier, and I'm the director of CDC's Division of Adolescent and School Health. Today, I'm really pleased to talk about mental health during the COVID-19 pandemic, starting with where we were as a country prior to 2020, the anticipated impact and current data about mental health during the pandemic, some of which we've just mentioned, and some solutions and resources for addressing mental health and building resistance. Just as a disclaimer, the information that we're going to cover today in this presentation is certainly not exhaustive, and it's meant to convey some important information, but certainly not all of the information that we could about mental health and resilience during COVID-19. And it is current as of November 30th, 2020, understanding that our information about COVID is constantly evolving. So prior to the pandemic, we were already seeing signs that mental health and resulting outcomes like suicide were problematic in our country. This graph of data from the Substance Abuse and Mental Health Services Administration, or SAMHSA, shows the past year prevalence of any mental illness, or AMI, among U.S. adults in 2019. Note that the definition of mental illness for the purposes of this graph is any mental, behavioral, or emotional disorder, which can vary in impact, ranging from no impairment to mild, moderate, and even severe impairment. In 2019, there were an estimated 51.5 million adults aged 18 or older in the United States with a mental illness. This number represented 20.6% of all U.S. adults. The prevalence of mental illness was higher among women than men. Young adults aged 18 to 25 had the highest prevalence of AMI compared to adults aged 26 to 49 years and aged 50 or older. Suicide is a significant growing problem in the United States. As of 2018, it is the 10th leading cause of death in the U.S. and affects all ages. It is the second leading cause of death for people 10 to 34 years of age. Some groups have higher rates of suicide than others. Suicide rates vary by race, ethnicity, age, and other population characteristics, with the highest rates across the lifespan occurring in non-Hispanic American Indian and Alaskan Native and non-Hispanic white populations. Other Americans disproportionately impacted by suicide include veterans, other military personnel, and workers in certain occupational groups like construction, the arts, design and entertainment, sports, and media fields. Even before COVID-19, for many adolescents, key indicators of mental health were moving in the wrong direction. The data you see here were collected through the Youth Risk Behavior Surveillance System, or YRBS. CDC administers this survey every other year in high schools throughout the United States, generating nationally representative data, which helps us describe the prevalence of adolescent risk behaviors and trends over time. In 2019, more than 1/3 of American high school students experienced distress, measured here by a question that asks whether students experienced feelings of sadness or hopelessness for 2 or more weeks in the prior year to the survey, to the degree to which that they were unable to do their regular activities, which are 2 aspects of the experience of depressive symptoms. You can also see here that we've seen significant increases in this indicator as well as suicide behaviors between 2009 and 2019. Mental health conditions were also disproportionately affecting specific populations, including young adults and Hispanic populations. And you can see from the graph on the left that Hispanic high school students have experienced the highest rates of persistent feelings of sadness and hopelessness over the past 10 years. Additionally, the graph on the right indicates that almost half of female high school students experience these persistent feelings of sadness and hopelessness. We've long known that isolation, loneliness, and mental health issues have been at the root of many of our social and health issues, and that these were moving in the wrong direction prior to the pandemic. So adding an infectious disease that, in the absence of therapeutics and vaccines, requires distancing in order to prevent spread can only have added additional pressures to these problems. The COVID-19 pandemic may be stressful for people. Fear and anxiety about a new disease and what could happen can be overwhelming and cause strong emotions in adults and children. Public health actions such as social distancing can make people feel isolated and lonely and can increase stress and anxiety. However, these actions are necessary to reduce the spread of COVID-19. Coping with stress in a healthy way will make you, the people you care about, and your community stronger. Stress during an infectious disease outbreak can sometimes cause fear and worry about your own health and the health of your loved ones, your financial situation or job, or loss of support services you rely on, changes in sleep or eating patterns, and difficulty in concentrating. It can also worsen chronic health problems, mental health conditions, and can lead to increased use of tobacco, alcohol, and other substances. And that is what we have early data indicating. We are seeing an impact on mental health from the pandemic this year. In a survey conducted in late June of 2020, 40% of adults in the United States reported at least one adverse mental or behavioral health condition. It's also important to make note that mental health conditions are disproportionately affecting specific populations, especially young adults, Hispanic persons, Black persons, essential workers, unpaid caregivers for adults, and those receiving treatments for pre-existing psychiatric conditions. Unpaid caregivers for adults, many of whom are currently providing critical aid to persons at increased risk for severe illness from COVID-19, had a higher incidence of adverse mental and behavioral health conditions compared with others. College and graduate students are also feeling the impact of the pandemic on their mental health. According to a rapid data collection pilot on school mitigation strategies funded by the CDC Foundation, preliminary data show that 45% of college and graduate students reported feeling depressed or isolated or cut off from people, compared to 36% of students in 9th through 12th grade. We also know from the existing literature on trauma, including adverse childhood events, or ACEs, that COVID-19 is likely to have mental health impacts on children and adults. This slide describes some of the potential impacts of trauma for older, that is elementary age children, and adolescents, including worry, irritability, acting out, eating and sleeping changes, depression, and PTSD. The number and severity of impact will differ by individual context, including age, prior history of trauma, prior state of mental health, social and emotional and economic supports, and others. A study conducted with parents and children in states hardest hit by H1N1 found high associations between parent PTSD and child PTSD. Other research on mass trauma from, for example, 9/11, the Oklahoma City bombing, and other school shootings found that the likelihood of PTSD is influenced by factors including knowing someone who died or was injured as a result of the trauma, hours spent watching media coverage of the event, and psychological status prior to the event. These impacts may also be seen in children and adolescents who are not able to social distance due to added anxiety related to a caregiver who needs to have daily contact with those in public, or who's working extended hours, or who is now unemployed. For instance, for those who are able to social distance, this may be a time of increased family connectedness. However, more time at home may come with its own set of risks. For many children and adults, home is not a safe place. We've already seen data to suggest that we'll see increases in rates of child abuse, domestic violence, and substance abuse. Data from police departments in 4 cities, including Jefferson, Alabama, Portland, Oregon, San Antonio, Texas, and New York City, highlighted increases in reports of domestic violence since the start of the pandemic. And in April, the number of calls, chats, and texts from LGBTQ youth to the Trevor Project's 24/7 crisis services doubled over the course of just 1 week. We have seen some of those potential reactions unfold in some of the challenges children and young people have been facing during the COVID-19 pandemic, related to changes in their routines, for instance, having to physically distance from family, friends, and their worship community, breaks in continuity of learning, for example, through virtual learning environments, technology access and connectivity issues, breaks in the continuity of health care through missed well child visits and immunization visits, missed significant life events in terms of grief over missing celebrations, vacations, and milestone life events, lost security and safety because of housing and food insecurity, increased exposure to violence and online harms, threat of physical illness and uncertainty for the future. And in response to this, CDC developed a COVID-19 parental resource kit, ensuring that children and young people's social and emotional and well-being to help support parents, caregivers, and other adults serving children and young people, and recognizing children and young people's social, emotional, and mental health challenges, and helping to ensure their well-being. Given the growing evidence of increased burden among racial and ethnic groups, special attention should be paid to the potential for increased stress to be observed among racial and ethnic children and young adults. This great resource leads me to say that there is good news. The good news is that people and communities are resilient. I know I just went through a lot of potentially stressful and difficult information, but the story is not yet completely written. We anticipate moving into the winter months, and particularly going through the holidays, that won't be celebrated in the same way as normal. We will absolutely have to take some extra efforts to make sure we are addressing mental health and building resilience. And we know a lot about how to provide support around mental health issues. We don't know necessarily about how to get those interventions into high-risk communities that may lack resources, and we'll need to take special care in attempting to do that. And we don't know a lot about how to do this under certain circumstances. This is the first major pandemic in 100 years, and we have many tools available to us that we didn't have 100 years ago. We're able to connect people virtually in a safe way. The key is to do it the best we can to break down the isolating barriers as much as possible. So part of the title of my presentation has to do with resilience, and I'd like to share the definition from the chairman of the Joint Chiefs of Staff instruction in 2011 that I think really resonates with our society right now. Resilience can be defined as the ability to withstand, recover, and grow in the face of stressors and changing demands. Resilience is important because it allows us to enhance our internal resources and identify mechanisms that can assist us when dealing with potential overwhelming experiences. It allows people to function in unexpected circumstances and cope with stressors. One way to think about promoting resilience is through the socio-ecological model. And you can see from the image that it starts with the individual, and every circle builds on the last. At the individual level, it's important to know what's going on with yourself. Make sure you're doing the things you can do to stay healthy and resilient. At the relationship level, it's important to check in on family and friends. So not only does that help build your own resilience, but then also is reciprocal to those others who are important in your lives. At the community level, it's important to know what resources are available in your community. Make sure you are translating your resources that are accessible during physical distancing. For example, employers should know what's going on with their employees. Don't assume that they're doing okay just because they're showing up on Zoom calls. At the societal level, isolation is a major underlying cause of many social and psychological problems. And the pandemic, in combination with others, can make this worse. We've been relying on socializing outside, but as we are now going into winter months, we need to watch out for each other and try to find ways to adapt what we know about how to increase connectedness into virtual settings. Something to consider at all levels of this model is consideration of the resiliency of both young people and adolescents and adults is the role of toxic stress and stigma experienced by racial and ethnic populations. During this pandemic, it is critical that you recognize what stress looks like, take steps to build your resilience and manage stress, and to know where to go if you need help. Whether you're going into work or working from home, the COVID-19 pandemic has probably changed the way that you work. You can find lots of tips to build resilience and manage job stress on the website in the chart, but I'd like to cover a few of them with you now. First, identify those things which you do not have control over and do the best you can with the resources available to you. Increase your sense of control by developing consistent daily routines when possible, ideally one that is similar to your schedule before the pandemic. Third, remind yourself that each of us has a crucial role in fighting this pandemic. In addition to what we just talked about, here are some broader ways to cope with stress in a healthy way. It's important to know what to do if you are sick and concerned about COVID-19. Please visit the link in the chat for specific steps to take to care for yourself and to help protect other people in your home and community. While taking steps to protect your physical health, Please be mindful of your emotional health right now. Some ideas on how to do that include taking breaks from watching, reading, or listening to news stories, including those on social media. Take care of your body. Make time to unwind. Find ways to connect with others. And find ways to connect with your community or faith-based organizations. And speaking of connecting with others and with your community or faith-based organizations, feeling connected to family and school has a number of positive effects. Connectedness is really kind of amazing. It's what some might call a high leverage solution, because just focusing on increasing connectedness between kids and their schools and families can reduce all of the negative outcomes you see here on this slide. Their risk of being a victim or perpetrator of violence, or of having multiple sexual partners or an STD, or of misusing prescription drugs or using illicit drugs and experiencing emotional distress. CDC findings published in Pediatrics suggest that youth who feel connected at home and at school were less likely to experience health risk behaviors related to mental health, violence, sexual health, and substance use 20 years into adulthood. Youth connectedness is an important protective factor that can reduce the likelihood of a variety of health risk behaviors. And adults who experience strong connections as youth were less likely to have mental health issues, experience violence, engage in risky sexual behavior, and use substances. School connectedness can also ameliorate the impact of ACEs and send youth who have experienced trauma on an improved path forward. Schools can provide this stability and connectedness so that youth feel that adults and peers in their schools support them and care about them. And school connectedness is defined as students' belief that their peers in school and school staff care about them, their learning, and them as people. So what about adults feeling connected? Just as being connected benefits youth, adults can reap the same benefits for their mental health from connectedness to friends, family, and community. Although many things feel harder in the virtual environment, connectedness is still vital, and there are still a few ways that connectedness can be fostered virtually. There is no one-size-fits-all solution. School and student context has to be taken into account. There may be disparities that influence accessibility to technology, and care must be taken to create ways to connect with all students without marginalizing those without access. Additionally, more direct individual outreach via email or phone would be helpful for all students and for families, and can be a way to learn more from families about resources needed in areas where students may need more help. Teachers, counselors, and other staff can do daily check-ins with students and families. Check in to see how students are feeling. For younger students, school may be using apps that enable a thumbs up or thumbs down, or a different emoji to indicate how they are feeling. For older students, there are some great resources out there, like the distance check-in form pictured from the Association for Middle Level Education. Tie social and emotional learning to management of COVID. There are several online SEL resources available. For example, the Collaborative for Academic, Social, and Emotional Learning has an online group for supporting SEL and guidance on their website. It's also important to establish and maintain rituals and routines, create regular check-in times, providing certainty wherever possible. And for school administrators, these same strategies that teachers and staff can use with students can be modified and used by administrators to staff as well as you navigate your own level of uncertainty and competing demands. Some other ideas of available services and activities include accessing healthcare in a different way by using telemedicine appointments, not just for physical health, but also mental health sessions when and where available. Using hotlines, such as the Trevor Project's Trevor Lifeline for LGBTQ youth in crisis, feeling suicidal, or in need of a safe and judgment-free place to talk. Finding ways to be active virtually through classes online, such as options from the YMCA. And taking advantage of virtual events like virtual tours of museums, concerts, and online classes. Next, I wanted to share a resource called How Right Now, a mental health and resilience initiative funded by the CDC Foundation to NORC at the University of Chicago with technical assistance from CDC, and which launched in August of 2020. How Right Now is a comprehensive partnership-based communication initiative that is grounded in research and focuses on addressing people's mental health challenges during the COVID-19 pandemic by increasing individual coping skills and ability to be resilient. How Right Now provides information, strategies, and resources through a website that you can see in the chat link that exists fully in both English and Spanish, as well as through its partner network of over 70 national organizations. Starting last month, in support of the holiday season, How Right Now is rolling out new content that aims to address the many different emotions people are experiencing this time of year. While the holidays are often a time of joy, excitement, and reflection for many, they can also be a time of loneliness, isolation, anxiety, and depression. This year, in addition to these mixed emotions, HRN has heard from its partners that communities, particularly communities of color, are grappling with substantial COVID-related grief and other losses. This is not just grief about the loss of life, but communities are also grieving the loss of normalcy. Many may have increased health worries or financial stress related to the pandemic. At the same time, people may be looking for silver linings or ways to be grateful during this time. To support people through this time, the initiative has launched a new landing page on howrightnow.org that addresses the many different emotions people are experiencing this time of year, with a focus on grief and gratitude. This includes updated resources for those experiencing grief, a new webpage on ways to practice gratitude, and a set of social media posts and graphics for partners to share on their social media channels that drive to the new landing page. You can see examples of this content on the right-hand side of the page. We can be connected to each other at a distance. There was a lot to begin with in 2020 that has had continued impact and brought to light some places where we need to do some more work. But there's also a body of knowledge we know about resilience and connectedness to improve mental health. Now the challenge is to figure out how to do those in the context of the pandemic. It's been great to see innovation from birthday card parades to supporting healthcare workers in New York City to Zoom calls with family and friends. Neighborhoods and communities are organizing for ways for people to feel connected. And there have been a lot of ways people have adapted to feel less isolated. When it comes to the holidays, we are used to spending them in person with family and friends. But there are still ways to connect over the holidays at a distance. Travel may increase your chances of getting and spreading COVID-19, so postponing travel and staying home is the best way to protect yourself and others this year. But you can also consider hosting a virtual meal with friends and family who don't live with you, scheduling a time to sharing a meal together virtually, having people share recipes and show the dishes they prepared, having a small outdoor meal with family and friends who live in your community while taking necessary precautions like limiting the number of guests, setting expectations with guests in advance, having guests bring their own food and drink, or if sharing food, having one person serve the food and use single-use options like plastic utensils. Safely preparing traditional dishes and delivering them to families and neighbors in a way that does not involve contact. Participating in a gratitude activity, like writing down things you are grateful for and sharing with your family and friends. We can do this. We can be resilient, we can be connected, and support each other even when we have to be apart. So in conclusion, the pandemic has been stressful for all of us, but it's really important to remember that we are resilient and that there are many resources available to help us feel connected and supported, especially when it comes to our mental health. And so here on this page is a list of resources that are available widely and can be used. So thank you for your attention. I want to wish you all happy holidays. And at this point, I'll turn it over to Dr. McDonald.
Thank you, Dr. Ethier. And this is Michelle. I'm actually going to kick us off with some questions. And I actually have one for Dr. McDonald to start with. Thank you very much to both of you for sharing those updates and the helpful resources. Before we get started with Q&A and start answering some of your questions, I want to take a moment to have you answer a couple of our questions for us by taking the poll on your screen. And I'll note that we received many great questions in advance of this call. So thank you all for sending those in advance. And we're going to get to as many of those as we can in the next half hour or so. And we'll kick it off with some questions about holiday gatherings and testing. So Dr. McDonald, I will direct this one to you. With the upcoming holidays approaching, what is the best way to protect against spread within home gatherings?
Well, thank you for that question, and thank you also for that presentation, Dr. Ethier. So in answer to this question, we have to say right off the bat that, of course, members of different households are at increased risk if they gather together. Mixing household units in different social circles brings increased risk. Some considerations, however, for reducing this risk include the following. First, check rates of COVID-19 in areas where attendees live and consider whether it's safe to gather on a given date in a specific location and with attendees from areas with particularly increased disease activity. Second of all, limit, of course, the number of attendees to maintain social distancing of at least 6 feet apart. Avoid direct contact. In other words, no hugging. As hard as that is to do, and have everyone wear a mask when not eating or drinking. Whenever you can, host outdoors over indoors as much as possible, understanding the weather is a major limiting factor in most places. However, increase ventilation of indoor spaces using simple measures like opening windows if possible or using fans. Another thing is to run the fan continuously in your central heating or air conditioning system. Next is encourage guests to avoid singing or shouting. Then finally, is important is who shouldn't come. And no one who has had a known close exposure in the past 2 weeks to someone infected with SARS-CoV-2 should attend. As well as no one who is waiting on a viral test, nor anyone with symptoms. Finally, I'll just say if you are personally at increased risk of severe illness from COVID-19 or live or work with someone at increased risk, you should take extra special precautions of avoid in-person gatherings as a whole with people who don't live in your household, and again, avoid these larger gatherings and consider attending activities that pose lower risk, as I've described, if you do decide to attend in-person gatherings. So there are a variety of things we can do, but and in fact, doing all of them wherever we can, layer on additional things to lower your risk. That's how I'd summarize it.
Thank you, Dr. McDonald. That's incredibly helpful. And I have another one for you about testing. And it asks, is the CDC recommending that individuals get tested for COVID-19 before attending a family gathering with people outside of the people they immediately live with?
No, a lot of people don't realize is that what we're talking about usually in these cases is a viral test. And viral tests, whether it's RT-PCR or a antigen test, only tells you whether you're shedding at that particular time. So if you test negative on one day, you could turn positive subsequently, even that same day later on, start to shed a virus. So testing at one particular point in time doesn't assure anything really, and so CDC does not recommend that.
Great, that's a helpful clarification, Dr. McDonald. And Dr. Ethier, I'll turn to you. We know that there are concerns of exacerbated health equity impacts during the pandemic. And we received another question concerning recent movements to look at social determinants of health during the pandemic and the need for consideration of some of the psychosocial determinants on overall health and wellness. Can you lend us your expertise a little bit on how we can move forward more intentionally focusing on providing mental health support and care to underserved communities, especially people of color during COVID-19?
Yeah, that's a really, really important question. Inequities in the social determinants of health, such as poverty and healthcare access, affecting these groups are really all interrelated and influence a wide range of health and quality of life outcomes and risks. CDC has outlined health equity considerations related to COVID-19 and racial and ethnic minority groups, and has developed a health equity strategy in addressing the pandemic. Finding ways to maintain support and connection, even when physically apart, can really empower and encourage individuals and communities to protect themselves, care for those who become sick, keep kids healthy, and better cope with stress. And while I think all of those issues are challenging for everyone, I think in already stressed communities, that can be even more difficult. Community and faith-based organizations, employers, healthcare systems, and providers, public health agencies, policymakers, all of us really have a part to play in helping to promote fair access to services, to needed services. So really to prevent the spread of COVID-19 and to ameliorate those differential impacts, we really have to work together to ensure that people have the resources that they need to maintain and manage their physical and their mental health, including making sure that there's easy access to information, affordable testing, medical and mental health care. We need to make sure that programs and practices that fit the communities where racial and ethnic minority groups live, learn, work, play, worship, all have the resources that they need. I think one of the things that the pandemic has demonstrated to us are those places, and I think having a health equity strategy will help us move in that direction.
Yeah, thank you, Dr. Ethier. That's a very helpful and important insight, I think. Thank you. And I actually have another question for you about frontline healthcare workers. So we know that our healthcare workers are stressed, they're overwhelmed while working to care for people with COVID-19, caring for their own families, and our healthcare system is strained. How can healthcare workers better care for themselves during the pandemic?
Yeah, healthcare workers have really been the heroes during this pandemic, making sure that others are cared for. But yeah, as you mentioned, providing care to others during the pandemic can really lead to stress, anxiety, fear, and other strong emotions. Healthcare workers, and in fact all of us, should recognize what stress looks like, try to take steps to build resilience and cope with stress, and know where to go if they need help. We do have some resources on CDC's website, but really one of the most important ways that we can help healthcare workers is to prevent the spread of COVID-19 transmission so that we're reducing their workload. So encouraging everyone to take the steps that Dr. McDonald mentioned to try to reduce the spread of the virus is probably going to be the most important way we can help healthcare workers.
That's such a great way to frame it, and it's such a good reminder, Dr. Ethier. That's very, very true. And some of the resources that you just mentioned are in the chat now for folks who want to check those out. Thank you. Dr. McDonald, I'll turn back to you. We have a question from a senior citizen, an older adult, who writes that she has some stable health risks. She's had some workmen over, construction workers over to help her with some home repair with significant water damage to her home. That sounds incredibly unpleasant. The workers all wear masks and enter through the patio as a mitigation effort, but she's wondering if it's safe to just discontinue this work with the rising cases of COVID-19 in her home state of Oregon.
Well, that's a great question. While we can't eliminate all risk, it certainly does sound like you're taking appropriate precautions to minimize the risk. Ideally, we would limit all interaction with others to greater than 6 foot distance in an outdoor space. However, once we move indoors, the wearing of masks by all individuals can do a lot to reduce risk. And this is the most important thing you are doing and should keep doing, especially when talking with one another in the same room. Another thing it sounds like you're doing is maintaining at least 6 feet whenever you are in the same room, and keep that up. Certainly. Finally, increasing ventilation by opening the patio door is a great idea. Other ideas include the use of a window fan or running the central ventilation fan continually with one or more windows open. Such increases in ventilation are especially important if for some reason the workmen would need to remove their masks for comfort, or if necessary, for some other reason. If that is necessary, they should only do so when you are not in the room, and never when they are speaking with you or within 6 feet of each other.
Thank you, Dr. McDonald, for that. And I'm going to shift us to the school setting for a moment with a question for Dr. Ethier. What processes should schools have in place to respond to the mental and behavioral health needs of students?
That's a great question, and it's a really important topic. So in the presentation, we talked about some of the ways in which increasing connectedness and decreasing isolation are really important for students. Also, communicating with faculty, staff, and students about mental health, so really bringing it up as a topic so that it's not something that's hidden or something that students especially don't feel like they can talk about, and being able to then be that conduit to the kinds of services that might be necessary. We provided a list of distress hotlines. So if you know that students, young people in your house or young people that you work with, if you are seeing signs of distress, make sure that they know how to access those distress hotlines. Make sure if you do work in a school that information is widely available to students, but also to faculty and staff. And I think also keeping track of what's happening in the mental health of school employees, whether that's faculty, other staff, anybody who works with youth right now, they're probably also pretty stressed out. And so making sure that you are checking in with them as well, so that they are able to then help their students access whatever they need, and to be there and to be that point of connection for their students are all really important things to do.
Thank you, Dr. Ethier. That's very, very helpful response. And I'll shift over to Dr. McDonald for the next question, which says many people are working from home, potentially at the moment. So Dr. McDonald, how can we best balance the need to socially distance and practice, some isolation without having it add to feelings of depression, anxiety, or just decreased productivity?
Well, during times of increased social distancing, people can still maintain social connections and care for their mental health. Phone calls or video chats can help you and your loved ones feel socially connected, less lonely, or less isolated. On our website, we offer a myriad of suggestions for connecting with others and staying safe yourselves. These include the basics: avoid close contact with others outside your household, wear masks, monitor your own health, and get a flu vaccine, as well as specific suggestions for the holidays, such as virtual gatherings, small outdoor gatherings, recipe exchanges, etc. For more, see the daily activities section of CDC's website.
Thank you, Dr. McDonald. Those are good suggestions. And kind of building on that last question with some of those activities, Dr. Ethier, I have one for you. Some people have written to us about their children that are dealing with high levels of stress, anxiety, and depression due to missing out on the experience of going to school day to day and seeing their friends and just having the in-class support face-to-face with their teachers. So what are some strategies that parents and caregivers can implement to support their kids when the parents are kind of compounded by their own stress and mental health burdens?
Yeah, that's a great question. And I'm really glad you acknowledge the additional stress that parents are under during this. It is really important to try to find ways for parents to take care of themselves and their own mental and physical health, so that then parents can be in a stronger position to help their children. But just a couple of suggestions that we have is to, for instance, talk honestly and openly and answer questions and share facts about COVID-19 in a way that your children can understand. Reassure your children that they're safe. Let them know it's okay to feel upset. Limit all of your exposure to lots of news coverage or social media that really just kind of exacerbates the feelings of stress. And trying to keep kids in a regular routine, and yourselves in a regular routine as well. Take breaks, get plenty of sleep, exercise, eat well, connect with your friends and family members, and let your kids see that you're doing that, because I think that allows you to be a good role model for them. And spending time with children in meaningful activities, reading together, exercising, playing board games. I think we've all heard, either had experiences or heard stories of during the first couple of months of the pandemic that people were having game nights with their family and eating dinner together in ways that they used to not be able to, but that can fall away as people get more stressed. And so just making sure that you're continuing to do those activities as a family. Family connectedness is just as important as school connectedness. So making sure that you as a family are bonding, spending that quality time together is really important.
Thank you, Dr. Ethier, for that. And we'll be dropping some parental resources for folks in the chat as well. Dr. McDonald, I have a question for you. Between the grief of losing loved ones in this pandemic and COVID-19 related financial insecurity that people may be facing, people have written to us about feeling helpless about the foreseeable future. What resources do you think can help us in this time to cope?
Well, I want to acknowledge the grief and despair felt by so many who have lost loved ones in this pandemic, as well as the anxiety many people face due to financial insecurity. This is a very difficult time. It's important to remember that there are things each of us can do to stop the spread of COVID-19. These include basic mitigation behaviors, social distancing, wearing masks, hand hygiene, as well as, in the near future, receipt of a COVID-19 vaccine. These things offer us hope for improvement in the new year. If you're concerned that you or someone in your household may harm themselves or someone else, please call the National Suicide Prevention Lifeline or the National Domestic Violence Hotline. And if you're feeling overwhelmed with emotions like sadness, depression, or anxiety, you can call the Disaster Distress Helpline. There are also resources to find help for substance abuse treatment and mental health providers. Links to these resources are in the chat and also on the CDC website.
Perfect. Thank you for those words, Dr. McDonald. And I will switch gears just a bit to say that there are some notable second-order impacts of COVID-19 that come to mind that folks have questioned us about, particularly around, child abuse, domestic violence, and food insecurity, things that kids may face at home. So what are ways to ensure that kids are being kept safe over the holidays in households?
Child abuse and neglect are really serious problems that can have lasting harmful impacts on its victims. There are several resources to help in a crisis situation, including the Substance Abuse and Mental Health Services locator for finding treatment for substance abuse. The goal in preventing child abuse and neglect is to stop the violence from happening in the first place. Child abuse and neglect are complex problems rooted in unhealthy relationships and environments. And preventing child abuse and neglect requires addressing factors at all levels of the social ecology, as we talked about earlier. CDC does have a technical package for preventing child abuse and neglect, and identifies a number of strategies based on the best available evidence to help states and communities prevent and reduce child abuse and neglect. I think, one of the most important things for individuals is to keep their eyes open for what some of the signs might be, and some of the materials that we provide can indicate what those signs are. Unfortunately, with many kids out of school, which is a place where many cases of child abuse and neglect are discovered, it's really important that we pay attention to the children around us, talk to them, and make sure that they're being cared for.
Thank you, Dr. Ethier. Those are very good points and helpful suggestions. And Dr. McDonald, I'll go over to you for a quick question about kind of exacerbations of chronic conditions during the pandemic, like diabetes, hypertension, and heart disease. So for those that are feeling anxious to go anywhere and have practice isolation, does CDC have recommendations for them on how to handle necessary in-person, annual doctor's visits and appointments?
Yes, we've learned a lot about preventing COVID-19 over the past year, including how to safely provide and receive vital preventive health care services. If possible, CDC recommends that individuals use telemedicine if available, or communicate with your doctor or nurse by phone or email. Talk to your doctor about rescheduling procedures that are not urgently needed. However, if visits in person are medically necessary, individuals should follow instructions from your provider, as well as basic mitigation measures such as wearing a mask as appropriate, not touching your eyes, nose, or mouth, and staying 6 feet away from others while waiting in lines and other things. CDC has developed infection control guidelines for healthcare providers, and the good news is that there are studies that show that necessary in-person care, for example, prenatal visits or even dental care, can be performed safely on a large scale with no observable transmission events.
That's great. Thank you, Dr. McDonald. And Dr. Ethier, I have a question for you. And we've got a few left, and I'm gonna plow through them. But Dr. Ethier, I do have a question on, you mentioned above some of the warning signs and risk factors. And this one specifically asks, what are the warning signs and risk factors that teens may be experiencing, teens that are experiencing emotional stress or anxiety due to the COVID pandemic? And how can families and caregivers best support them to be resilient?
It's a great question. Some of the telltale signs include expressions of fear and worry, especially about health and the health of loved ones, changes in sleep or eating patterns, including difficulty sleeping, difficulty concentrating. If you notice that any kind of chronic health problems are getting worse, or expression of any existing mental health conditions might be getting worse. Something that might be a little bit hidden, but that you would want to attend to is whether there's any use of tobacco, alcohol, or other substances going on. You know, coping with stress in a healthy way is incredibly important for adults and teenagers. So, you know, both caregivers really need to take care of themselves as well as taking care of others, including teenagers. So I think trying to maintain those connections, having open conversations, if you have teenagers in your house, making sure that you're just really continuing to connect. If you have teenagers in your life that you are that you can maintain connections to through video calls or text or social media, that's really important. In addition to suggestions that I made earlier about how to help children, it's really important for parents of teens to deal with COVID-19 calmly and confidently. Parents can be reassuring if they're better prepared. So in addition to CDC's website, there are other resources such as strongforlife.org, which give tips on helping teens deal with the grief that they may be feeling during the pandemic. And so, checking out those sources of information so that you can then help your teenagers, I think, is really important.
Those are very helpful. Thank you so much, Dr. Ethier. And Dr. McDonald, I have a last question for you around adults with disabilities who find it difficult to breathe while wearing a cloth mask, or the cloth mask poses some challenges for them. So what should they do to best protect themselves?
Well, CDC recognizes that wearing cloth masks may not be possible in every situation or for some people. In some situations, wearing a cloth mask may exacerbate a physical or mental health condition, lead to a medical emergency, or introduce significant safety concerns. Adaptations and alternatives should be considered whenever possible to increase the feasibility of wearing a cloth mask or reduce the risk of COVID-19 spreading if it is not possible to wear a mask. If cloth masks cannot be used, make sure to take other measures to reduce the risk of COVID-19 spread, including, of course, social distancing, frequent hand cleaning, and cleaning with disinfections, cleaning the environment with a disinfecting agent of frequently touched surfaces.
That's great. Thank you, Dr. McDonald. And I know we're at 4 o'clock, but we do have 2 last questions that we had emailed in, and I'll do my best to combine them and turn them over to you, Dr. Ethier, to speak to both components. But we've been written by many who feel that the pandemic has been the root cause of some increased anxiety and worry for them. So the first part of the question is, does CDC have resources to address this COVID onset anxiety? And then the second question is kind of, the second prong is a flip of that question. What are some signs that indicate that it's no longer kind of regular holiday stress or stress from the pandemic, but that it's turning into a mental health crisis or an emergency? So I'll turn it over to you for those last 2 pronged questions.
Yeah, that's both important and kind of both sides of the coin. So we have, I think, all of the resources that we mentioned today around how to improve resilience, maintain connections, connect with resources that can be helpful, regardless of whether or not you were having anxiety symptoms before COVID. Or everything about 2020 has created anxiety. I think all of those resources are really good and really important and can be utilized regardless of the source of your depression or anxiety. And so knowing where and how to get treatment is really important, as I said, regardless. Doing some of the self-care things that we talked about, taking care of your body, taking care of your mind, mindfulness, eating healthy, exercising regularly, getting sleep, avoiding excessive drug and alcohol use, all of those things, again, regardless of the source of the anxiety, are all helpful things to do. I think if you find that stress is getting in the way of your daily activities for several days in a row, kind of the item from the YRBS that we talked about, if you're feeling really sadness and hopelessness and that lasts for a period of 2 weeks or more, and if you are unable to do your regular activities, those are 2 good indications that what's happening is probably needs some attention. So again, tap into any of the free or confidential resources that are available that we provided along the way in the presentation today. Check out our websites. Hotlines are free and can be very helpful. I would say be mindful of your use of alcohol and drugs. If you find that your use is increasing, you might want to take a break. I know that can be difficult over the holidays, but give that a try. And if that becomes difficult, you might want to seek help for treatment. People with pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. This is really important. If you think you have new or worse symptoms, please contact your healthcare provider. And if you are really at a crisis point and having, for instance, thoughts of suicide, please call 911 or one of the more specific hotlines that we included in the chat. But I think overall, the goal is to find joy in the holidays where we can, attend to what we're feeling and attend to what's happening with our loved ones, and access the resources that are available to us when needed, and really just kind of attending to what we know is happening for a lot of people right now. And so, yeah, using the resources that are available and really paying attention to ourselves and those around us.
That is incredibly helpful and a good way to kind of end the call right there, Dr. Ethier. That was to being attentive to ourselves and those around us. So that's a good message to take home. And this concludes our time together. I really appreciate you all sticking around for an extra 5 minutes or so. And definitely a big thank you to our panelists, Dr. McDonald and Dr. Ethier. Thanks so much. And a recording, I will remind everyone that a recording will be posted online on CDC's COVID-19 webpage and on YouTube within a few days. And the subscription link to receive future updates and invitations to this call is listed on the slide, so you can click that. And thank you again. Please join us next time on Monday, December 7th, and our topic will be new school tools for a healthy new year. So you can send us questions in advance, and until next time, be well and take care of each other.